Yes.
So before we take an emergency impromptu action of firing the CS, as much as she is incompetent, let's find a solution when the CS is there. When we are done with this crisis, then the parliament, with their mouthing, they take an action of the process of trying to remove the CS. Let the president refuse to remove by the approval of the National Assembly, then let's take action, right? But we cannot say that we are going to remove the CS Nyakumincha because of this particular crisis.
Yes.
Then we leave the doctors where? Let's have a very simple solution. Let's call the doctors on board. Let the Lex of Chief of Staff
yes.
come on board.
Yes.
Let them speak the mind of the president. Let them tell the CS. Because what we need here is the assistant in the Ministry of Health. We don't need to fire anyone. We need to boost the people who are going for these CBA discussions so that we are able to know that this is a policy discussion. We does not need to implement it here. If this is a policy discussion, let's implement policy discussion. When you implement a policy discussion, you've not done a favor to doctors. It's a policy requirement. Let's go to issues that are in the CBA. The reason why you see doctors are not relenting is one. The people that involved them in making this CBA in 2017 that was supposed to be implemented in 4 years' time, that have already lapsed, are now in this government holding very serious positions. They know what it takes to implement the CBA, whether we have the money as the government or not.
Yes.
So the president needs to come on board even through his other agents
yes.
to ensure that we solve, because the way it stands, the CS is not able to solve this situation.
And
we are not going to expect the CS to do anything new
yes.
as per what he's doing now.
Yes.
We call her in the meeting again, she will do the same thing again and again. Remember, people are dying in the hospitals, and other time you see nurses are also in the streets. So even if we allow doctors to go back to the hospital, where are the nurses? The doctors cannot operate with the nurses. In those small hospitals, in those villages, nurses are like doctors. So we need to solve all these things once and for all.